How much do dental implants cost? This is a really common question, and it does depend a lot on what we're using the implants for. So in a case where you're already wearing full dentures, for example, maybe you're wearing the upper one successfully. Very commonly, the lower one is the one that flops around quite a lot. The cost of adding a couple of dental implants and a couple of locator attachments to your own current denture isn't so costly on the scale of things at all. And in fact, doing that treatment plan is actually less costly than a replacement of a single tooth with an implant. So that can range from a lower scale there to where we are talking about replacing single teeth, multiple teeth, and all teeth. And the replacement of all teeth is a very complicated discussion because there's a whole bunch of different options you've got in terms of what's the prosthetic framework we're going to place on top. We're going to use something in titanium and ceramic, which is what looks real, or we're going to do a denture style prosthesis as well. And they all have different costs. So I suppose the thing we try and be really good about here is really making those options clear and giving people choice, because there is no right or wrong way. Everyone's got different circumstances with this sort of treatment. We leave it up to them to decide, because as soon as you understand that and understand what you can expect from those results, then I think people get a bit more comfort. So in terms of talking about cost, the big thing I want everyone to appreciate is every case is very different. It mightn't sound different to everyone, but I can tell you right now, the cases that look straightforward often aren't, and the cases that look simple often are very complicated. So when it comes to talking about costs for each individual and each individual situation, it's really, really important that we have the information we need in front of us to give people some more assurances on cost, because I don't think there's any value in just throwing numbers out there if that's not what it's going to be. And I don't either making it too high or too low and giving people surprises later on. That's not what we're about here. The individual assessment with dental implants is the most critical step of the whole place, and that then dictates exactly what has to happen or what needs to be considered before we can move forward.